Hi everyone, Dr. Peterson here with Regions EMS for today's daily COVID update. Today is Monday, March 30th, 2020. Information is current as of today, is changing rapidly, and likely will be different tomorrow. That means that you need to stay tuned to our website, regionsems.com, as well as our YouTube channel, Regions Hospital EMS, for the most up-to-date information on the COVID-19 outbreak. We will update the date on our websites, on our COVID resource page, whenever the information is reviewed, so you can always be confident that the information that is available there is the most up-to-date information that you can have. There's also, a frequently asked questions section on the site that may be helpful if you have questions about what you should be doing. Let's start with a couple statistics. So worldwide, there are, as of right now, 741,000 confirmed COVID-19 cases, 35,000 deaths, and the number of actual cases is likely higher just because not everybody has been tested. In the United States, according to the CDC from yesterday evening, 122,653 confirmed cases, just over 2,000 deaths. In Minnesota, we have 576 confirmed cases out of about almost 19,000 tests and 10 deaths as of this morning. Wisconsin has just over 1,112 cases out of about 16,500 tests run, with 13 deaths. And again, the number of cases is likely quite a bit higher just because we are not able to test everybody that is having symptoms. Unfortunately, we are starting to see a spike. I think we are still several weeks away, this is my opinion only, from our peak outbreak, but we are starting to see a spike, and I think things are going to start getting quite a bit busier with the respiratory complaints and the flu-like symptoms here in the next few weeks. Because of that, the ECMO team has suspended operations at Regions and Southdale. They are still operating out of the University of Minnesota. So if you do have an ECMO eligible patient, please still call the ECMO team, but just know that you will be directed to the U of M rather than to Regions Hospital for the time being. It just got to be too complicated with the change of rooms and the PPE coordination. They need to be at one site and be able to manage things safely and appropriately. And then finally, just a reminder that we, as far as crisis standards of care, we still consider ourselves to be in the contingency phase, which means we have started modifying some of our daily operations. Things are not necessarily business as usual, although our volumes are still low enough that we should still be responding to every call and appropriately treating patients and transporting as necessary. We do have some guidance on our website for limiting some of the minor transports of the symptomatic COVID potential patients just to limit your exposure if they do have other ways to get evaluated either in the clinic or the hospital. But just keep in mind that at this point we are not refusing anyone care, obviously. We are not refusing transports that should be transported by ambulance. When we get to that point that we are in the crisis mode where we are horribly overwhelmed with 911 calls, then we will provide further guidance at that point. But we are in regular contact with our communication centers in eastern Minnesota and western Wisconsin to make sure that we are staying on top of the situation. Today's topic that I'll highlight is protect others. Last Friday we talked about protecting yourself, and like I said, I will repeat these topics on a weekly basis in order to shorten the videos a little bit. In order to protect others, several things that we can be doing right now. First is limiting riders in the ambulance who are not patients. That includes staff, your colleagues. You know, you don't necessarily need 3 or 4 people in an ambulance if you can avoid it. We can bring the patient. If they absolutely need a guardian or a support person, you use your judgment. But again, most hospitals are limiting or restricting altogether visitors in the emergency department. So that person's going to have a difficult time when they get to the ED getting in. We also need to practice social distancing as much as we can. That involves any gatherings in the ambulance bays in between runs. We have started seeing some positive cases amongst our public safety professionals here in the Twin Cities. So we do need to be mindful of that, and it would be disastrous to our workflow if the disease were to start sweeping through any of our agencies. So as much as you can, I know it's tough, especially those of you who are career, who work 24-hour shifts with each other. It's hard to separate just in the confined space that you find yourself in on a regular basis. But we need to do what we can to limit our contact with other people. Be mindful, obviously, of where you're donning and doffing your PPE, so you're not doing it in the ambulance bay as other crews are walking right by you. We don't want to cross-contaminate anything if we can help it. Cardiac arrests should not be transported unless there is a clear reason for the transport. Most of our arrests are not shockable, and in most cases, those should stay on scene and be worked on scene. Unless there's clearly a procedure that the hospital can offer that you can't, or something like ECMO for the shockable patients, let's limit the exposure, especially in CPR and manual ventilation situations where we are aerosolizing some respiratory particles, and we really want to limit the amount of people and surfaces that we expose while we're moving those patients. So just be selective, use good clinical judgment, use medical control if you need to help make those decisions. PCR signatures for now, I would not, I think that it's not necessary to obtain patient signatures and even staff signatures at the receiving hospital. You can clearly document that you were unable to obtain a signature and the reason why, that there's a current pandemic and we're limiting contact. So that will prevent multiple people from touching your tablet, using your stylus, possibly cross-contaminating things. So just keep that in mind too. Sometimes it's the simple things that we overlook. And then finally, just remember that hospitals may start screening everybody, including you as EMS providers, law enforcement, first responders, with a quick temperature screen and a question, a short questionnaire when you arrive. That's fine. You know, we need to be very vigilant. We need to be checking temperatures on shift. We need to be monitoring our own symptoms. We need to be very careful so that we don't create an outbreak amongst our EMS workforce here in the Twin Cities. All right, last Friday, our trivia question, where does the word quarantine come from? We did have several replies, and I'd like to give a shout out to Linda from Northland Ambulance in Frederick, Wisconsin, Dan from 3M and the Baldwin Area Ambulance, as well as Joni, one of our per diem instructors with Regions EMS that many of you may know. The word quarantine comes from a 17th century Venice area, Venice, Italy. Ironically, during the period when all ships were required to be isolated before passengers and crew could go ashore during the Black Death plague epidemic. Quarantine comes from the Italian word quarantana, or quartana, which means 40. And so these ships were held isolated out in port for 40 days before they were allowed to disembark. Obviously, we've shortened that to 2 weeks for the current outbreak, but quarantine is still a very relevant term. For the next question, if you think you know the answer, email it to regionsems@healthpartners.com and we'll give you a shout out in our next video. The Spanish flu affected people the world over and killed up to 50 million people. So why then is it only named after Spain? We'll see that answer tomorrow. In the meantime, stay safe, stay up to date. We'll talk to you later.